questions and making sure there's an understanding of what we're trying to say and we can explain it in kind of a local way. We're only going to ask the you questions. We can cross out the family. You don't have to repeat it for your family. So go ahead and cross that out. When we're gathering the data, we're just going to ask, do you have diabetes? And you fill in yes or no. If they don't know, don't fill in anything. Don't cross out no. Not knowing is important. If somebody's hypertensive and they don't know they're hypertensive, we learned that there's a disconnect between their health and their knowledge about their health. So if they don't know an answer, leave it blank. Okay? Yes, circle yes if they say yes, no if they say no. If they don't know it, leave it blank. We have decided we're not going to do weight, height, and BMI if they're not children. If they're children, we'll do their weight and height. If they're not, we're going to do urine on everybody. And so at registration, Gloria is going to give barcodes. They're stickers. We're going to put the sticker on the patient intake form, and the last two numbers will have markers, and we're going to write it on the cup. We just have little urine cups. So at registration, we're filling this out. We're putting a sticker on this, and we're putting the last two numbers of the barcode on the urine cup. So if the last two barcodes are 34, 34 goes on their cup. That way, if they have many people in their family and they come up with many urine cups, we know which urine belongs to which patient.
And just one more QC, and it won't take that much longer to do it, and I found that we needed to do this on each cup because, as Katie said, if we have numerous family members or we mistakenly invert the number, write their last name on the cup. It'll take you a second. Write their last name on the cup with that last number of this barcode.
Okay, so then at registration, you're going to fill out this, you're going to fill out the survey, and you're going to give them a urine cup and tell them to go urinate in the cup. So they can go do it wherever they need to do it. We haven't had a lot of issues, but the second station, so they leave that station, and you tell them where we set up the urine station. So the second station, they'll take their urine cup and they'll give it to the urine test people. And we have urine strips that they'll dip it into. At the urine station, we're testing for three things. We're testing for protein, we're testing for glucose, and we're testing for blood. So these things, and it's out of order, and I apologize, there's a couple mistakes. The urine just says +2 yes. This is our indicator of risk, but regardless of what their score is, we want to know it. So your options are negative, trace, +1, +2, +3, right? We want to write that down, and then you can check if it's over +2, right? What we're doing here is we're determining risky, high-risk patients through these tests. Which ones can go to well educations and which ones need to see a nephrologist. And this is one of the tests that will determine that. So we want to write down, and again, there's not a mark for it. So you guys just have to remember, we'll go over it at the urine station. We need to write down what their urine test was on protein and then mark if it's over +2. Then we're going to do the same thing for glucose. We're going to do negative, trace, +1,